Hello and welcome to Body Watch, your guide to a healthy life. The importance of keeping fit and healthy is known to all of us, and yet in our busy lives, we often forget to take care of the basics. Body Watch is your weekly reminder that a healthy body and a healthy mind is your greatest asset. As always, we bring you the newest and the most varied information on matters of health. This week we have for you the new entrant, robotic surgery, lifestyle management, a new concept in living. Asthma is more common than you think. And oxygen therapy, yes, it helps. But first, let's check out the latest health news. The World Health Organization claims the best hope for a cure to malaria is emerging from China. Experts believe a powerful Chinese herbal remedy could crack this disease, which affects nearly 300 million people worldwide. New research suggests HIV patients who take cholesterol-lowering drugs may be able to slow the advance of the virus. If proven, this would be a remarkable breakthrough. A recent study shows lack of sleep can cause chemical changes in the body. Sleep deprivation may increase age-related chronic disorders such as heart disease and diabetes. And now for our main stories. Medical frontiers are crossed quite frequently. One of the most interesting in recent times has been the advent of robotic surgery. Lending a mechanical hand to surgeons, these remote-controlled robots can operate in tiny spaces no human hand can ever reach. And moreover, they come with their own camera.
Toys have always fascinated us, but with the times changing, our toys also change shapes and roles, from simply entertaining us to working for us and saving our time to even saving our lives. Yes, robotic surgery at the Escorts Heart Hospital is one such example.
Robotic surgery basically is describing what we call robotic assisted surgery. That means a surgeon is using the assistance of robotic instruments and robotic interface to be able to perform the surgery away from the console. So what it means is that with the help of robotic assistance, you can operate on a patient with robotic instruments which are very small, which are like 2, 3, 4 millimeters in diameter.
The Automated Endoscopic System for Optimal Positioning, AESOP, is a surgeon-controlled robotic arm capable of maneuvering and positioning an optical tube with a camera at the end called the endoscope.
Right, stop, left, stop, left,
The voice-controlled AESOP 3000 surgical robot was launched with the ambitious objective to try and overcome present human limitations in surgery by means of an advanced technology. The AESOP 3000 robot has the shape of a human arm, allowing the surgeon to execute direct and precise control over the endoscope using simple verbal commands. These voice commands are previously recorded onto a voice card, which is programmed into the controller. Recognizing the surgeon's voice commands, the surgical arm acts in synchrony. The robotic arm automates the tedious and tiresome task of holding the endoscope, providing stable vision and consistent, predictable scope movements. The endoscope, a specially designed optical tube connected to a medical video camera and light source, is introduced into the body in order to view the operation on a video monitor. Since the medical video camera magnifies the view up to 15 times, even the slightest natural hand tremor can adversely affect the surgical approach. But thanks to the AESOP robot, a steady operative field is being guaranteed so that surgeons can perform minimally invasive procedures in the chest cavity with a high degree of confidence and effectiveness.
We started with doing surgery with small incisions because the reason why we had to make a big incision was to see inside what we were doing. So for that came the first generation of robot, which we call ESOP, which is a voice command robot. We can put it through a 3 millimeter hole in the side of the chest. You can see everything 3D on a screen, and you can actually command this robot to go where you want it to go. So with this move alone, we did not have to open the chest so much as to be able to look directly inside.
The advantages of robot-assisted minimum invasive surgery are that only tiny incisions are made in the patient's body. Thus, they suffer far less from pain and trauma than those with open heart interventions. Consequently, they need shorter hospital stays and recover faster than usual. There certainly is a reason to smile even for those suffering from diseases closer to their heart.
Lifestyle management. Did you ever think you would need professionals to manage your life? But that's exactly what this innovative approach to life planning is all about. Check out what some call a most rewarding experience.
Modern lifestyle, even if it is well bestowed upon, runs a high risk of troubled health. Indians as a race have 7.5 times greater incidence of cardiac diseases and 3 times higher rate of hospitalization. While the blame largely lies on the genetic makeup of our countrymen, the stress also has its share. Though much cannot be done at present to eliminate the genetic causes, complications can surely be avoided by a modified lifestyle management.
Lifestyle management is basically a very recent concept wherein people thought that it is time that we start believing the old theory and statement that prevention is better than cure. We were practicing it, but not in a very scientific manner. But now, of late, lifestyle management has taken a very scientific analogy.
Lifestyle management is worked out after detailed consultation and analysis done by several specialists.
We have got 4 or 5 components of this, in which essentially what we are trying to emphasize upon is exercise, nutrition and diet, relaxation technique, identifying the risk factors and subsequently trying to modify them.
Stress analysis is a major component of precautionary diagnosis. It is important because stress can trigger off the secretions from the neurotransmitters in the brain, which narrow the coronary arteries and can cause heart attack. Stress test is followed by the person's history.
If somebody has got a history of hypertension, somebody has got a history of diabetes, somebody has got a near relative who has had a coronary artery disease, and if somebody is a smoker, hypertensive, stressed executive, obese, these are people who are exceptionally at a higher rate of developing coronary artery disease. Now, second is trying to identify those factors which a person does not know.
The biochemical tests include the estimation of blood sugar, cholesterol, lipids, and other significant indicators. Simultaneously, physical tests like ECG and treadmill tests are also performed to ascertain the health. But these have limitations. They cannot detect cholesterol if it is below 70%. As this can be too late, calcium scoring test is also performed.
Whenever you pick up calcium in the coronary arteries, this means that the fat deposition process has started. And these are the individuals who are 4 times at a risk of developing a coronary artery disease event in subsequent years.
Once complete analysis is done, the person is referred to a nutritionist who takes all the identified risk factors into account and works out a proper diet. The effort is to modify the risk factors mostly by the ways of nature and some supplement of drugs, that too if required. Additionally, relaxation techniques and some yoga exercises are also recommended.
Once we identify a person that he is prone to develop coronary artery disease, say we identify that this is the population, 10% of which will develop some amount of coronary artery disease in the next 10 years. Now, once having identified that, When we subject them to lifestyle management, we expect that if they continue with this kind of a lifestyle management program, this 10% population should reduce to about 2.5 or 3.
Modified lifestyle management is not a therapy, but a wiser way of living, a method of killing the disease before it attacks, and can spell miracles, especially for those who are prone to cardiac problems. For them, it can ensure a better life through careful daily routines.
Asthma is a breathing disorder that affects nearly 5% of adults and 10% of children globally. Not known to have any definite cure, this age-old malady remains an enigma even as more and more people succumb to it.
Life is deeply indebted to the rhythms of non-stop breathing. Even a little discordant note, a small break, has the power to threaten the very existence of life. Such discordant notes can be introduced by several factors. Asthma is one of the biggest one. It is a deceptive disease that can lay dormant for years and can be triggered by small instances of irritants like pollution, dust, cold, or even cats. When asthma attacks, the person faces difficulty in breathing, which is due to a deformity in the breathing tube. It is a set of two small muscular tubes that carry air to the lungs. In case of asthma attack, the lining of the tubes swell and the muscles are tightened. Some sticky mucus or phlegm is also produced. As a result, the air passage is narrowed down considerably and there is a problem in breathing. Whenever the symptoms of asthma emerge, the relief should come immediately. Special inhalers and relievers are the popular mode of instant medication. They release calculated amount of medicine which relax the muscles of the breathing tube and makes breathing easier. The inhalers are often used in conjunction with spacers, which slow down the speed of medicinal air streams and make it easier for the patients to inhale them. Majority of patients have difficulty in using these spacers due to their exorbitant cost. Now the innovative spirit of a young researcher may end the predicament of such patients. This scientist has designed the spacer from empty bottles of mineral water, bringing down its cost to almost nil.
The main thing is that people should know and that they are getting the best thing without paying anything for it.
This ingenious spacer can easily be made at home. The base of the bottle is cut according to the size of the inhaler's outlet, and the inhaler is fitted in it. When the patient inhales it, the medicine reaches him with ease.
Inhaler, that medicine coming at a rate of 114 kilometers per hour would reach his lung unless we settle it somewhere. So I thought of this bottle, plastic bottle, where the medicine remains stationary, and it remains stationary, it is there for 30 seconds and patient has to inhale it.
Its simple fabrication and easy use is a boon for asthmatic people, who are more than 150 million in this world and constitute nearly 5% of the Indian population. The spacer may lack brand value, but is perfectly effective and can provide them the necessary relief.
The world of alternative healthcare is expanding every day. Hyperbaric oxygen therapy or breathing 100% oxygen is becoming increasingly popular the world over and is especially beneficial in the treatment of acute disorders.
This is not a scene from any spacecraft or any astronaut training program. These people are simple patients attending a special form of therapy called hyperbaric oxygen therapy, a new treatment which is used in addition to the conventional method of medication.
Hyperbaric oxygen therapy is a form of treatment wherein patients are given oxygen under pressure. This oxygen under pressure is different from the oxygen we give patients in the ICUs because it dissolves in the plasma and it can reach those parts of the body where oxygen would normally not reach.
It is a simple therapy conducted in a special pressurized chamber. To begin with, the patient is examined for ability to equalize pressure, state of lungs and eyes, and other general details. After the checkup, the patient is given a mask or a hood for easy breathing. Thereafter, the attendants leave the chamber and gradually the oxygen pressure is increased. In about 10 minutes, it reaches up to 2 atmosphere and is then stabilized. The treatment lasts for 60 to 90 minutes. During the period, the oxygen enters the body system and induces several effects, which are considered useful in various ailments.
The beneficial effects of hyperbaric oxygen is achieved because a large amount of oxygen dissolved in the plasma reaches the tissues. We find conditions such as non-healing wounds, people with diabetes who have long-standing ulcers, people who have radiation-induced ulcers, problems because of having been exposed to radiation, and that has great effects on the body. So radiation could affect the gallbladder, it could affect the urinary bladder, it could affect the intestines, or it could leave an ulcer. And these patients benefit very much from hyperbaric oxygen.
It is also beneficial in cases of thermal burns, where it decreases the fluids, inflammation and edema. In plastic surgery and in skin graft, it is effective in promoting capillary proliferation and granulation, which are helpful in preparing the graft site. Hyperbaric oxygen therapy is also useful in cases of brain injury, cerebral palsy, and tumor, etc. And doctors give reason for it.
Process of aging takes place because there are some free radicals which are generated in the body. Now these free radicals are not removed, they cause the process of aging to take place, and which is why a lot of vitamins which they call free radical scavengers are being promoted by pharmaceutical companies. When you take oxygen under pressure, this also helps to clear the body of these free radicals, and because of that it does have an effect of anti-aging, of a good skin suppleness.
Hyperbaric oxygen therapy may seem like an exotic therapy. Actually, it is quite simple and within reach. Whatever be the clinical achievements, it does provide some relief, and that is the reason for its growing popularity.
That's all for now, but before we leave, take a look at the Body Watch tip of the week. For bronchitis in children, mix 1 teaspoon oil of garlic and 3 teaspoons of honey and give a small amount 3 times a day to the child. We'll meet again next week with more news and views on health. Till then, take care.